Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. I think my diabetes is wrong, eh? I hope I'm right now. Okay, so guys, this is part 3 of diabetes and food. Like I said, that diabetes, controlling the blood sugar, is more of a diet than anything else. It's about 90% diet and 10% medication for those who exercise and also exercise. So I want you guys to try by all means to be patient with me and try to grasp what I'm trying to explain to you. So let's just go back. We say that after we have eaten, this is the blood vessel full of glucose molecules. This is after we have masticated our food, digested, absorbed into the blood. Now we've got a lot. We've just eaten. We've got a high or elevated levels of sugar in the blood. So these are our cells, bone cells, muscles, epithelium, any cell you can think of in the body, even brain cells. So after we've eaten, what is supposed to happen is that we're supposed to get a glucose shift from the blood into the cells under the influence of insulin, so that these cells can be able to remain metabolically active. So we need this insulin. Talking about, this is endogenous insulin, the one that we produce from the pancreas, the islets of Langerhans, the beta cells. So after we've eaten, I'm just gonna take a random number. Let's say we've eaten and our blood sugar is now 50 millimoles per liter. The insulin will drop that blood sugar up until it gets to the normal levels. And normal, we said, should be less than 11 millimoles per liter. So we've got a blood sugar that is 50 millimoles because we've eaten and we want to get it to below 11. This is the blood sugar of a normal person who's not diabetic postprandially after they've eaten. And moving from 50 to less than 11 is the work of insulin. This is the time when the insulin works the most, right? And when the blood sugar is getting to around 15, 14, 12, 11, the insulin is released very slowly now and in small amounts, because the body doesn't want to take all the glucose from the blood into the cells and making a person to be hypoglycemic. So when the blood sugar starts to be less than 11, the insulin sort of like stops being secreted there. Because once you get to hypoglycemias, now you need insulin to stop being secreted, because you're going to push this patient further into hypoglycemia. And a different kind of a hormone is secreted, and that is glucagon. Okay, so guys, this is a normal person. This is what happens in a normal person. When you are diabetic, you get your 50, we're using 50 as an example, guys. Ne? You get your 50 millimoles because you have eaten just like person A. Let's call this person A. Person A is not diabetic. He takes a 500 mils of Coke with a burger. His blood sugar does that, and then in like 2 hours, 2 hours to 3 hours, his blood sugar gets to less than 11 because the insulin is working well. Everything with his insulin is fine. Receptors, the secretion, the beta cells are secreting it. Everything is just fine. But the person who's diabetic, because of a problem with the insulin system, so instead of having their blood sugar less than 11 in 2 hours, they remain elevated for over hours and days. Their blood sugar, it might not be 50 throughout, it might be 40 something dropping, but the important thing is that after 2 hours, their blood sugar will still be more than 11 millimoles, and even after 4 hours, still more than millimoles, still more than 11 millimoles. So they've got a chronic elevation of blood sugar, right? That's person B who's diabetic, right? So because the insulin is not doing its job in this case, that's why they cannot drop their blood sugar. And the reason why we need to get the blood sugar into the cells as soon as it comes is we know that a chronically elevated blood sugar causes chemical changes at an anatomic level, and then tissue damage occurs, target organ damage occurs. That's what we don't want. And number two, as long as you've got a blood sugar as long as you've got a sugar or a glucose that is in the blood and not in the cells, it means these cells cannot respire, so they are starved. So you want to get it into the cells so that they can produce ATP and life continues, right? Okay, that's what I wanted to clarify before we can move on. Now I want us to talk about, I'm introducing two terms to you that I haven't mentioned before. Controlling, like I said, controlling a patient's blood sugar is all about the diet, 90% about the diet. Now we've got the terms like low glycemic index food and high glycemic index food. We want the patients to be on a low glycemic index type of food, and I will explain that. Let's first talk about high glycemic index food. What do they do? Most of the times, high glycemic index food are foodstuffs that have been processed, refined. They have gone through a lot of preparation such that by the time we get them, they're not complex anymore. What is the problem with this? The problem with high glycemic index food is that once you eat them, they causes blood sugar spikes. Meaning they causes an increase, like an increased blood sugar. They causes like they give us elevated blood sugars, like very high, like very high blood sugars. And because of that, people who consume them, okay, let me make a graph to sort of like explain this. This is for someone who's not diabetic, ne? This graph is someone who's not diabetic. This is gonna be time, this is gonna be blood sugar. Let's say this is 8 o'clock in the morning. This is 10, this is 12, this is 2 o'clock, this is 4 o'clock. This person wakes up and eats high glycemic index food, whatever that they eat, but high glycemic index. Because they're not diabetic, so they wake up with a blood sugar of less than 6.5, right? So let's say they wake up with a blood sugar of 5. Let's say they wake up with a blood sugar of 5. So this is 5 here. So, and then they eat the high high glycemic index food. So immediately they eat that, their blood sugar is going to shoot up. This is what we call a spike. Shoot up very high, and once it gets to the peak, the insulin will pick it up that we've got a lot of glucose now. It's going to be activated and start dropping the blood sugar. Because they're not diabetic, so it's going to drop it up to about 11. Remember, when you're not diabetic, after we have eaten, your blood sugar should not be more than 11 millimoles. So it gets to about 11, right? When it's around, when it starts dropping to 8, 6, 7, this person is going to feel hungry. Then they will eat. When they eat again, the same thing happens. They get another spike in the blood sugar. And whether it gets to 50 to 40 depends the quantity and the type of high glycemic index food they ate. But what I'm trying to demonstrate here is that they get these spikes, then they eat again. Same thing happens. This is what we call spikes, blood sugar spikes. Now, because after you have consumed high glycemic index food, you get a spike, and during this time is when the blood sugar is still going up or being elevated or being raised. Because remember, when you eat, blood sugar is gonna, the glucose is gonna be absorbed from the intestines into the blood. So until all the glucose has been removed from the intestines, you're gonna continue having an increase up until you get to a peak. And then after that, when the insulin has been activated and is now busy decreasing the blood sugar, shifting it from the blood into the cells, you're gonna get a dip. This is when the insulin now, the dip is when the insulin is actually at work and decreasing or transporting those glucose molecules across the blood vessels into the cells. This is when we are still absorbing and absorbing and absorbing. So you get these spikes. The problem is high glycemic index food is that you get spikes, but when you're not diabetic, it's not an issue. The only problem is that these people, in about 3 hours, they always feel hungry again, even though they've eaten. And because of that, they eat frequently and they pick up weight. Because they get the spikes. You will see the difference between high glycemic index and low glycemic index food, how the impact that they have on the blood sugar. For high glycemic index, remember, it's the spikes, number one. I want you to remember the spikes. A spike is a very elevated blood sugar. And you get dips. And when you get the dips, you feel hungry and then you eat again, you get another spike. And this thing continues throughout the day. And that's why people who eat high glycemic index food, they eat a lot. They don't eat 3 meals. They eat more than that. If they don't, they always need snacks in between. Right? That's why I'm saying, if you can compare two people, or you compare yourself, you say, okay, today or this week, I'm gonna take 2 slices of bread, like white bread with coffee, and then write down the time you ate those, and then the time you had your second meal or the time you feel hungry again. Do that, and then the following day take whole wheat bread. Whole wheat bread is going to sustain you longer than those two slices of white bread, which is a refined and processed kind of a bread. So this is a non-diabetic person. Let's talk about now someone who is diabetic and is consuming high glycemic index food. So I'm going to use a pink to demonstrate that. So what's going to happen is this person is going to eat the same food that this person, let's say the blue is person, the non-diabetic one, let's say it's person A. Now person B